Stress is causing a large amount of severe health problems in many individuals. According to CBN News, Dr. Lopez, stress and stress management are growing concerns in today's workforce. Today's society and its demands take responsibility for about half of all the stress in our lives. The remainder is internal self-generated stress from our own emotions. Dr. Lopez says during a stressful situation, heart rate, breathing, blood pressure all increase. In addition, blood rushes to the head and there's a loss of color in the face, and you experience muscle tension and there is a cold sweat over the body. He states that this stress cycle is produced by the adrenal glands, which produce the hormone called adrenaline. When stress is uncontrolled, there is an increased and prolonged production of the adrenaline hormone. Too much production of adrenaline decreases the storage in the adrenal glands, causes inability to control when adrenaline is released, and this turns into frequent anxiety attacks since the hormone releases randomly. Furthermore, the inability to control anxiety attacks causes depression and requires lifelong medication or therapy. Dr. Lopez says 30 million individuals suffer from uncontrolled anxiety attacks. Another hormone that is produced during stress is called cortisol, which is responsible for our body's metabolism, blood pressure, insulin levels, and proper immune system. Dr. Lopez studied this and said under stress, this hormone increases its production, causing an irregular chemical balance in the body. Prolonged stress also causes survival-oriented behavior, also known as SOB, which is purposeful for surviving acute danger. An article by Dr. Granville, during SOB, the higher brain center is suppressed, which occurs in the prefrontal cortex. This suppression causes holes in the prefrontal cortex and suppresses intelligence and judgment. Another protein that is produced is interleukin-6, an immune system protein that is usually higher levels in people with increased and prolonged stress. This is studied by Smith, Siegel, and Siegel, all with their master's, PhDs, and doctorate's degrees. By obtaining large amounts of this protein, it has been associated with diseases such as cancer, diabetes, infections, heart disease, osteoporosis, and rheumatoid arthritis. Some stress-related health problems due to all the increase in hormones include high blood pressure, heart disease, stroke, cancer, depression, obesity, diabetes, abusive behavior, and memory loss. All this is stated by Smith, Siegel, and Siegel. An example of the higher levels of SOB in someone who has prolonged stress, a brain looks like this. In a healthy brain, without the prolonged stress, there is not as many holes and they have a lower SOB level. Individuals with high amounts of stress should find ways to lessen it or find ways to cope with it differently. The simple realization that you are in control of your life is the foundation of stress management. Take charge of your thoughts, your emotions, your schedule, your environment, and the way you deal with problems. Have a balanced life with time for work, relationships, relaxation, and fun. Dr. Smith, Siegel, and Siegel say, until you accept responsibility for the role you play in maintaining or creating it, your stress level will remain outside of your control. Some healthy ways Smith, Siegel, and Siegel say to manage stress is by using the 4 A's. They are adapt, avoid, alter, and accept the stressor. Avoid the stressor is done by avoiding people who cause stress, decrease a to-do list, and learn to say no. Alter the stressor by compromising, expressing feelings, being assertive, and correctly manage your time. Adapt to the stressor by reframing problems, look at the big picture, adjust your standards, and focus on the positives. Accept the stressor by venting, do not control the uncontrollable, look for the upside, and learn to forgive. Of course, never forget to have time to relax and have fun. Today, 90% of diseases are caused by prolonged stress. This is stated by an article by Scott Stress is is normal response to events that make you feel threatened or upset your body's chemical balance in some way. Although some stress is okay, most prolonged or unnecessary stress is not. Today, almost every situation that individuals deal with throughout life causes stress. You are hurting your health when you obtain prolonged and high amounts of stress. Dr. Smith, Dr. Siegel, and Dr. Siegel say many emotions become affected during times of stress. They are physical, emotional, cognitive, and behavioral. Physical symptoms include aches, pains, nausea, diarrhea, constipation, dizziness, chest pain, and rapid heart rate. Emotional symptoms include moodiness, irritability, short temper, aggregation, and depression. Cognitive symptoms include memory, inability to concentrate, poor judgment, anxiety, and constant worrying. Behavioral symptoms include irregular eating and sleeping, isolation, and drug abuse. These symptoms can be reduced. You need to recognize situations that cause stress and find ways to adjust them. A prolonged or unnecessary stress is harmful to your health and is dramatically increasing in individuals' health today. It needs to be lessened and controlled. If you are experiencing prolonged stress, you need to find ways to cope and accept the stress. By decreasing stress, you improve your health. Is stress worth an unhealthy lifestyle? The next time you are stressed, look at the big picture and take a walk.